Jackson County, Georgia, located in northeast Georgia, is a rural county with about 61,000 residents. In the county, the only local hospitals are the Northridge Medical Center in Commerce and the Athens Regional Clinic and Gwinnett Clinic. Many residents travel outside of Jackson County in order to receive their medical care. African Americans living in Jackson County are faced with high rates of unhealthy birth outcomes and lack of prenatal care. According to the Jackson County Minority Health Report Card, the county received a county grade of F for prenatal care and birth outcomes. Infants born preterm, born less than 37 weeks gestation, have a greater risk of not surviving until their first birthday compared to infants born full term. Preterm infants that do survive have a greater risk of developing long-term disabilities such as chronic bronchopulmonary disease and cerebral palsy. Poor pregnancy outcomes can also have negative effects on the mother, such as type 2 diabetes, hypertensive disorders, and cardiovascular disease. African Americans deliver more preterm infants compared to non-Hispanic whites and Hispanics. In 2007, 1 out of every 5 African American births were delivered preterm compared to 1 out of every 8 to 9 non-Hispanic whites and Hispanic births. Although there have been major advancements in technology and medical care, racial disparities continue to exist. Access to adequate prenatal care is critical for a healthy pregnancy, but African American women are less likely to receive prenatal care compared to white women. In Georgia, the number of low birth weight infants born less than 5 pounds 8 ounces, increased from 12,000 to 14,000 between 2003 and 2007. The number of very low birth weight infants born less than 3 pounds 5 ounces, increased from 2,300 to 2,700. Infants born with very low birth weight account for 2% of the total births in Georgia, but is the result of 50% of all infant deaths. Medicaid could play a major role in reducing racial and health disparities in pregnancy outcomes. Early initiation of prenatal care is key in a healthy pregnancy and allows for adequate time to diagnose and treat any medical conditions. Compared to women who are uninsured, women on Medicaid may be more likely to receive the adequate prenatal care needed. In order to ensure Medicaid participants receive all care needed, policies need to be implemented for services such as transportation, social work, and behavioral health. Another way to address this health disparity is by using photo voice. Photo voice uses photos taken by individuals that show the experiences they face in their everyday lives. The pictures are able to educate and could even have an impact on policies. Photo voice would be effective for informing what women in the community experience and how it impacts their health. Lastly, an organization that could be helpful in addressing prenatal care and birth outcomes is the Special Supplemental Nutrition Program for Women, Infants, and Children. WIC's mission is to improve health outcomes and the nutritional status of the low-income populations. Participants on WIC receive food, nutrition education, and referrals for women, infants, and children who are at a nutritional risk. Studies have shown that African American women on WIC had less preterm deliveries when compared to women who were not on WIC. A program such as WIC has the ability to reach a large group of low-income women and children and would be a great advantage to the women in Jackson County in order to reduce preterm deliveries and low birth weight infants. Addressing birth outcomes and women's health is a critical community issue in Jackson County. Organizations and individuals need to come together to help improve the health of women and infants in their community.